So 8 years ago, the FDA came out and said, hey y'all, fluoroquinolones are actually pretty dangerous. Especially for older people, people with hypertension, Marfan's syndrome, Ehlers-Danlos syndrome, atherosclerosis, and a bunch of other things, right? So dangerous that the risks of these serious side effects probably outweigh the benefits. So stop prescribing them if there are any other alternatives. Just stop. So then they decided, let's just 8 years later, right? Let's do a study and see if they've stopped prescribing fluoroquinolones at the same rate as they did before, because we told them, hey, these are super dangerous. Don't prescribe these unless you absolutely have to. So here's the study. Yeah, just published a couple days ago. And guess what? There was no change in prescribing rates. Doctors are still prescribing fluoroquinolone drugs at the same rate as they were before the warning came out. Which is terrifying. Terrifying because most people that are diagnosed with EDS don't know to avoid fluoroquinolone antibiotics, and most of the people that have EDS don't know that they have it. So since we're all going to have to collectively self-screen ourselves for EDS and then advocate for ourselves not to be prescribed fluoroquinolones, or if we are prescribed fluoroquinolones, to ask for something else, I figured I would walk us through the Beighton score. Okay, I'm going to be this weird person. We're going to do this together. So there are 6 hypermobile joints. There are thumbs, little fingers, elbows, knees, and the trunk. So you get a possible total of 10 points. Okay, so the first one is your pinky finger. Can you take your pinky finger and pull it back past 90 degrees? I cannot do it. So that is a 0 for me here, and it is a 0 for me here. Although my hands are my fingers are crooked, so. But if you get one pinky finger on this side, it's 1 point. If you get one pinky finger on this side, it's another point. And you want it to be greater than a right triangle, right? Greater than 90 degrees. So the second one is your thumb. Can you take your thumb and push it all the way to your wrist, which I can do on this side, so that's 1 point for me. And on this side, I can also do it, so that's 1 point for me. So I've got 2 points total, running total right now. So the third one is hyperextension of the elbow beyond 10 degrees. So my elbow should go like this, but she can crank down pretty far. So I'd say that's probably 10 degrees, right? So that's 3 points. And let's just look at this girl. Yeah, she can also look like she's broken. So 10 degrees. Okay, I have to move you to the floor to do the next one. So it is passive extension of the knee beyond 10%. Or 10 degrees. So if I stand up straight, it's like this, right? But I can bow those suckers out. Both of them, right? So now we're at, 6 points? And the last one is, can you stand up and touch the floor with your feet flat on the floor and your palms flat on the floor? So I can also do that pretty easily. See, the green screen's really messing up. So out of a total of 9 points, I got 7 points. So most diagnostic criteria cut off at 4, and anything above 4, you're considered hypermobile and most likely have EDS. But sometimes they go as low as 3, they consider you to have EDS, and sometimes they go, you really need 6 to be considered EDS. But guess what? I have never had an EDS diagnosis, not once in my life. Do I probably have EDS? Yeah, I know I probably have EDS. I've always been really unstable. My joints move in weird positions. Standing is harder for me than walking is. But if I didn't come from a medical family that also had EDS in it, I wouldn't know to screen myself for EDS and not take fluoroquinolone antibiotics. And doctors in the ER sure as hell are not going to screen me for EDS before they hand me a prescription. And remember, EDS is not the only contraindicated condition with fluoroquinolone use. It's also older adults. Just sorry, if you're older, no for you. Patients with hypertension, so high blood pressure, also not for you. Higher blood pressure puts a lot of pressure on the arterial and vascular walls. And if we have a lot of pressure, plus we have collagen breakdown from the fluoroquinolones, you're more likely to have an aneurysm. Atherosclerosis, a lot of people have that and they don't even know that they have it until they throw a blood clot and have a heart attack or a stroke. In peripheral vascular disease, you could totally have that and have no idea. So maybe we should just routinely offer another antibiotic until fluoroquinolones become our last choice for everyone. Probably, just like a thought.